Abdominal pain, bloating, easy fullness when eating, nausea are symptoms which, if persist for weeks or months, can significantly affect the quality of life, work performance, and overall well being. Quite often, gastrointestinal or abdominal symptoms can be explained by abnormalities found on lab tests, imaging studies, or endoscopy. But what happens when all these investigations are normal, yet symptoms persist? This is the reality for millions worldwide living with functional dyspepsia, a condition marked by chronic upper gastrointestinal symptoms without an identifiable structural disease. So, how is this recognized and how can it be effectively treated? Stay with me, and in the next few minutes, we will explore exactly that. Hi, I'm Dr. Francisca Osago. Thank you for joining me on Francisca on Health Matters. One of the central goals of any wellness journey is achieving a quality of life that allows us to function at our best, professionally, socially, and personally. Persistent physical discomforts can be a major barrier to that goal. These symptoms are as distressing and disruptive as upper abdominal discomfort, especially when it lingers for weeks or even months. And this is often the experience of those living with functional dyspepsia. Functional dyspepsia is far more common than many realize. It is a common cause of chronic upper gastrointestinal symptoms in adults worldwide. Despite its prevalence, it remains widely misunderstood, both by the patients and at times within clinical practice. One reason for this is the complexity of gastrointestinal symptoms. Abdominal pain, bloating, nausea, and early fullness, also known as early satiety, are not unique to functional dyspepsia. These symptoms can also be seen in conditions such as gastritis, peptic ulcer disease, esophageal disorders, or other structural problems of the upper gastrointestinal tract. Each of these conditions requires a different diagnostic approach and management strategy. For this reason, careful evaluation during history, physical examination, and investigation by the physician are all essential. And it is often advised to clearly describe all symptoms, even those that might seem unrelated, as this information helps guide the appropriate testing. And depending on the clinical context, this evaluation may include testing for the bacteria Helicobacter pylori, commonly called H. pylori, assessment for cardiac and pancreatic conditions, and when red flag features such as an advanced age, or what is described as alarm symptoms such as weight loss, difficulty swallowing, or blood in stools are present, endoscopic examination of the upper gastrointestinal tract might be necessary. Yet, in many individuals with functional dyspepsia, these investigation results return normal, and this can be very confusing and discouraging. When multiple tests show no structural or biochemical abnormality, it might feel as if the symptoms are being dismissed or no clear solutions exist. However, the absence of abnormal finding is not a failure of diagnosis. As a matter of fact, it is a defining feature of functional dyspepsia. Current scientific evidence supports functional dyspepsia as a disorder of gut-brain interaction involving factors such as altered gastric motility, heightened visceral sensitivity, impaired stomach accommodation after meals, low-grade inflammation, and psychosocial stressors. In other words, the symptoms are real, measurable in their impact, and biologically grounded, even though they do not appear on standard imaging or laboratory tests. And understanding this is a crucial step forward. While functional dyspepsia can be very challenging during diagnosis, But once recognized, effective treatment is possible using individualized, evidence-based approach. Before a diagnosis of functional dyspepsia is made, it is essential that appropriate testing is carried out to exclude other conditions that can present similar symptoms. This include Helicobacter pylori infection, gastritis, and peptic ulcer disease, conditions which, if left untreated, can lead to serious complications, including gastrointestinal bleeding and, in rare cases, life-threatening outcomes. Once structural dyspepsia has been diagnosed, meaning no structural disease has been identified, treatment focuses on symptom control and improving quality of life. Several treatment options that are helpful will include medications that are acid suppressing under the category of proton pump inhibitors and H2 receptor blockers. In addition, certain medications traditionally used for anxiety or mood disorders, such as low-dose selective serotonin reuptake inhibitors or agents like buspirone, may be prescribed, though at much lower doses than for which they are primarily intended. And these medications can help modulate gut-brain signaling and reduce the visceral hypersensitivity. Functional dyspepsia is classified as a disorder of gut-brain interaction, a group of conditions characterized by altered communication between the gastrointestinal tract and the central nervous system. Irritable bowel syndrome is another well-known condition within the same category, and the overlap between these two conditions is common. While medications play a key role, long-term treatment also depends heavily on addressing lifestyle-related factors. Ongoing psychological stress, poor sleep quality, dietary triggers, physical inactivity, smoking, and the use of certain medications, particularly non-steroidal anti-inflammatory drugs, can all worsen symptoms and should be addressed. Emergent research also highlights the role of gut microbiome in functional dyspepsia, and it suggests avoiding the unnecessary use of antibiotics and minimizing the use of medications that disrupt gut health may improve symptoms. It is important to recognize that improvement often takes time, and patience is required as lifestyle changes and medical therapies gradually take effect. Continued follow-up with a healthcare provider is essential to monitor progress, reassess symptoms, and ensure that no new warning signs develop, particularly in older adults or those with a significant family history of gastrointestinal disease. Finally, it is worth emphasizing that functional dyspepsia is a diagnosis of exclusion, meaning other gastrointestinal diseases have been excluded using objective parameters. Many gastrointestinal conditions can present in similar ways, and some require timely interventions to prevent serious outcomes. And this is why persistent or concerning symptoms should always prompt a discussion with a qualified healthcare professional. Choosing a healthy lifestyle is an important step towards being your best self, and it should always go hand in hand with medical guidance tailored to your individual need. I hope you found this information helpful, and if you did, please don't forget to like, share, and subscribe if this is your first time or you're yet to subscribe, so you can receive more of my wellness content. Thanks for watching. Again, I hope you found this informative and educative, and if you have, please like and subscribe, and I'll see you in the next one.